Hi, I'm Dr. Jesse Wallace with Airrosti, and today we're here to talk about disc herniations. We'll talk about what a herniation is, what causes it, what the signs and symptoms are, and what traditional healthcare can do for it, as well as what Airrosti does and how it's a little bit different. So let's get started. A disc is the soft tissue portion of the spine that bears the weight. It lies between two bones. You can think of the disc as a jelly donut. It has a fibrous outside and a gel inside. When the two bones compress enough, it can push that gel in through the fibers and into the area of the spinal column where the nerves are. And this is what typically causes pain. So what are some of the common causes of a herniation? Herniations can be caused by trauma involving the neck or low back in cases such as falls or car accidents. Poor posture, sitting, standing, lifting with poor posture. Excess body weight compresses the disc between the vertebrae and that can cause a herniation. Even something like smoking. Smoking can decrease the blood flow to the disc and over time kill the tissue, which can lead to a herniation and pain. Now let's discuss some of the signs and symptoms that you have to look out for that may indicate that you're dealing with a disc herniation. A pinched nerve in the neck can manifest as numbness, tingling, burning, achiness, or pain down the arm or upper back. It can also present as weakness in the shoulder, arms, or hands. In the low back, it can present as sciatica, which is numbness, tingling, burning, or pain down the glute, thigh, and even to the foot. It can also present as weakness anywhere along that path. Now let's discuss some of the ways that traditional healthcare deals with disc herniations. When you go see your primary care doc or orthopedic specialist, a lot of the times the first thing they do is order imaging, such as x-rays or MRIs. But the fact of the matter is that about 50% of the population after the age of 40 are walking around with bulges and herniations and don't have any symptoms to show for it. So if they find something on the imaging, that doesn't necessarily mean that that's what's causing your symptoms. The vast majority of back pain cases and pinched nerve cases are actually coming from soft tissue components such as muscle spasms or connective tissue putting pressure onto the nerve. And even if your symptoms are coming from the herniation, studies show that conservative methods are still the best. Treatments for such things are including surgeries, like cutting away the disc that's putting pressure onto the nerve, fusion of the spine, epidural injections, and sometimes your doc will prescribe physical therapy or chiropractic. So let's talk about what we do with the disc herniation at Airrosti. First and foremost, you're going to get a thorough evaluation that's going to use orthopedic and functional assessment to determine the actual root cause of your issue. So whether it's a disc, it's a muscle, it's a tendon, it's a ligament, or it's a combination, our job is to use manual therapy to permanently change the structure back to where it was before there was an injury, and we add rehab and home exercises and home education to know exactly what you need to do to keep from coming back and seeing us again for the same thing. We hope that the information presented today was helpful. If you or someone you know is dealing with the disc herniation, we'd love to help. And you can click on the button right here to schedule today. So thanks for watching, and we'll see you in the next video.